Winter of 2018, Drew was acting a little funnier than normal. Dizzy, we were picking him up from daycare for headaches and just odd things. We thought he had a sinus infection. They sent us down to Norton Brownsboro to take an MRI of his head because he was having a headache and dizziness. And it was at that point that they had told us that they found something on Drew's brain. So Christmas Eve, they got to take an ambulance from Norton's Brownsboro to downtown, and they admitted us. And Christmas morning, at 8 in the morning, we got to go up to the 8th floor, and Dr. Muchnick and his team awesomely on Christmas morning and Christmas afternoon, it was about a 13-hour surgery, resected a tumor, medulloblastoma, out of Drew's head. So he came down, and that started a long process of chemotherapy, a couple of bone marrow transplants, and overall about a 9-month inpatient stay at 7 West.
I was getting surgery a lot, and people called me Super Drew because I did all those hard things in the hospital.
What was the hardest thing, you think?
Surgeries.
Surgeries, yeah.
And getting my brain cut open.
Getting your brain cut open. It's amazing where he is now. I mean, because he literally was in a wheelchair and they were helping him drink water. But now he's jumping around like a crazy little 7-year-old. And that's pretty super to me.
This is the Infusion Center, and Drew comes here to get his treatments done. In the Infusion Center, we have 20 rooms and 1 exam room. We have some closed door rooms, and we have these small infusion rooms that have a curtain. We have our own pharmacy here on the floor, so they make our medicines. This is our child life cabinet. So in here we have different activities or prizes that the kids can pick from. It's hard being sick and having something going on. And to have to come in here to do this, it's a big downer. So having activities or having things for them to do, or prizes for being such great kids for the day, having to get stuck in their arm or getting their port stuck. I mean, it's a way to at least kind of pump them up and to help them feel stronger and able to fight the battle.
I am Jeremy, and this is
Drew Esposito.
Drew Esposito, and this is 7 West, the Addison Joe Blair Cancer Center. And we're gonna go in and take a look.
Hello.
He was really nervous you're gonna smell his feet.
No, I'm not.
Oh my gosh, it's so good to see you.
Oh my goodness. What the heck?
Yes.
Oh, you look so good.
He's got hair, who knew?
This is our medication room. Something that's really convenient for parents is, especially our kids that come in several times during their treatment and during their time with us and their diagnosis, they never have to remember to bring those medications from home. We're giving them all their medications. We can head in here. One of our lovely pharmacy employees is stocking our medication, but this is just a place where we can grab all of the things they need for their medication. We can mix medication in different flavors for kids to take, things that you don't think about for children that are a little bit different than adults is how are we gonna get them to take this medication? So this is where that kind of magic happens for our patients. So what's really cool, what's in here, do you know? Slushies. So what's really cool about the slushie machine that we have on 7 West is we can use it to get calories in our kiddos, but we can also use it for meds, and then we can also use it during chemotherapy. There are certain chemotherapies that can kind of be rough on your mouth. So we found with evidence-based research that using something cold in your mouth while you get that chemotherapy can prevent some of those infections and some of those painful things happening in your mouth that are mouth sores associated with chemotherapy. So let's go get a slushie. Do you want one?
Yeah.
This is our 7 West specific playroom. What's really cool about this room is we kind of treat it like a sacred space, so we don't do any procedures procedures, any painful, anything in this room. We don't give any medicine in this room because we want kids to have a place to go on the unit where they are safe. So do you want to go inside? Okay. So we've got toys for pretty much every age group. Life doesn't stop. Developmental milestones don't stop when you're diagnosed. So it's really nice that we can support babies up to teenagers meeting those milestones while they're in the hospital. This is our laundry room. This is where patients and families, especially those who stay for a really long time, get to do laundry, which seems like something so small, but for our families, it really makes a difference in their stay, being able to have clean jammies, clean sheets, clean feet, clean socks. Normal day-to-day tasks like doing laundry or cooking in our kitchen can make the stay just a little bit more normal, and especially helps kids when they have their own stuff to wear. So the hospital gowns get old after a couple days. So having their own jammies and own sheets make a big difference. This is our adolescent and young adult unit. We call it the AYA unit. Something special about this is we try to place our teenage patients back here. It's a little quieter, so we can really provide a private space for our teenage patients. We specifically put a larger TV in here, musical instruments that teens may be more interested, like a drum set. We've got video games in here, poker sets in here, just really a space for teenagers to hang out. This is our bone marrow transplant unit. We have to be really careful with this patient population because we want to make sure they are isolated as much as possible for infection risk. So we have this hallway of a unit. This unit has its own nutrition room that we saw earlier, the one for all of our patients. This unit has its own special nutrition room so that parents don't have to risk cross-contaminating with any kind of other infection to keep these kiddos especially safe. We do a lot of work to keep all of the patients safe, but this unit is very special and we try to keep it on a little bit of a lockdown while patients are here. Once a patient reaches certain goals in their treatment, they can play in this hallway, and again, safely away from the other patient population to keep them safe. So this area is something really special to us that we love. We, through our foundation and through a couple different organizations, are able to provide families toiletries during their stay. So we have plenty of toiletries for all ages, all genders. We have razors for parents, we have toothbrushes, deodorant, makeup wipes, diapers, pull-ups. The hospital, of course, provides all of those things, but we can provide parents extra for their family members or things that they need in the room that maybe the hospital doesn't have as a whole that are unique to our patient stay. Working on 7 West and with Norton Children's Cancer Institute is a full circle moment for me. I started by working with ULDM and creating Raise Red with a group of very talented peers and colleagues, and now I'm working at Norton Children's Hospital. And really the impact of Raise Red is all those extra things that you've seen today, all of those unique experiences that patients and families get on this unit are funded by events like Raise Reds. I know sometimes it feels like you might not see the connection to what you're doing or see where the money is going, but it's going directly into this unit. So it's really important for these families. Their life did not stop when they got diagnosed, so anything we can do to make that experience better is wonderful, and you guys are doing that by participating in the dance marathon and planning. So thank you so much for all that you're doing.